I fell in love with pediatrics, and I also realized that pediatrics is not just care of the child, it is care of the family. Well and sick visits for me are, one, a chance to kind of re-engage with the family if I know them. If I don't, I acknowledge, and say, welcome to our practice. We're happy that you're here. Establishing trust, establishing rapport, and getting to the crux of what their concern is. I may see concerns, I may hear concerns, but I try to tune in on what the family is concerned about and then work my concerns in perhaps around those. I like to meet people where they're at. And everyone is at a different place in their life, in their situation. And I find that having that approach actually gives people the opportunity to tell me things that perhaps they may not share with other providers or even other family members. It offers them health, and it offers them an opportunity to participate in their care, which I think is what people would like to do. Patients of all ages. I tend to kind of sit down a little low and make sure that I'm making eye contact with kids. I think that, it's less intimidating. Sometimes I take my white coat off. I feel like I'm a little bit more approachable when I don't have a white coat on. So I change, based on the situation, based on the age of the child, but always speaking to the child in an age-appropriate manner, and then engaging the family if the child happens to look over at the parents. I feel like I'm a professional problem solver, and at any given moment in the office, I may know the patient and the family, or I may not know them. And so I have to quickly, figure out how to gain their trust, get them to tell me what it is that is bothering them so that I could help them. So that's, I think, the most rewarding part